So picture a morning you've, lived 1,000 times.
Oh, I'm sure we all have one of those.
Right. Your older Havanese wakes up in the home they've known for years, and they still follow you into the kitchen, maybe just a beat slower than they used to, right?
Just a little bit.
Yeah, and they still want to join you on the sofa, but there's this, I don't know, this tiny, almost imperceptible hesitation before they actually make the jump.
Yeah, that hesitation is so common.
And you look at them, you see the gray around their muzzle, and the most natural thing in the world is to just think, well, they're just getting old.
Right, the classic excuse.
Exactly. But what if I told you that getting old is actually the biggest myth in canine care?
It really is. It's a huge misconception.
So we are doing a deep dive today into the senior years of the Havanese. We're pulling from a really comprehensive guide to caring for this specific breed as they age.
And it's such vital information.
It is. Our mission today is to help you decode these subtle, everyday shifts in your dog's behavior. We want to figure out how to proactively adapt your care so your dog doesn't just age, but ages with genuine comfort and dignity.
Which is what every owner wants, at the end of the day.
Exactly.
Yeah.
So, okay, let's unpack this, because I'm starting to think about a dog entering its senior years kind of like a smartphone running a brand new background operating system.
Oh, I love that analogy.
Right, because you download the update overnight, and the phone looks exactly the same on the outside the next morning. You might not even notice the update at first.
Sure, nothing seems different.
But suddenly, the battery drains just a little bit faster, some of the apps run a little differently, the hardware hasn't changed at all, but the internal processes are fundamentally shifting.
That background OS update is exactly the shifting mindset owners really need to adopt.
Yeah.
Because aging, it's not a single dramatic birthday where a switch suddenly flips, You don't wake up on their 10th birthday with a completely different animal.
Right, it's not like turning off a light.
Exactly. And the sources we're looking at, they make a point that is absolutely vital to establish right up front. A senior Havanese does not need your pity.
Oh, that's a great point.
Yeah, it needs your thoughtful, adapted care. We constantly fall into this trap of assuming every single behavioral change is, well, just getting old.
Like it's a catch-all excuse.
Right. But age explains the statistical risk for certain conditions. Age itself never actually diagnoses the cause of a change in behavior.
So getting old isn't a diagnosis.
No, not at all.
That completely reframes how we should look at this new normal. The slower rising, the changing barks, the sudden pickiness with food.
You have to look deeper.
Right. Instead of writing it off, we need to look for the root cause. And the sources point to this massive, yet somehow entirely overlooked physical root cause for a dog's bad day, which is their mouth.
Oh, absolutely. The mouth.
Yeah. Dental comfort seems to dictate everything for a senior dog.
The mouth is the keystone to a senior Havanese's overall health and comfort. We are talking about a breed with a very small mouth.
Right. Tiny little jaws.
Exactly. Which means their teeth are really crowded. And crowded teeth create the perfect breeding ground for plaque and calculus. Over time, that develops into periodontal disease.
Which sounds painful.
It is. And people often dismiss the most obvious symptom. They notice a terrible smell and think, well, old dogs just smell bad.
Oh, the classic old dog breath.
Right. But that odor isn't old age. That odor is bacteria, active decay, and chronic inflammation.
Wow. And the sources outline highly specific warning signs to watch for beyond just the smell.
Right.
Like chewing on one side of their mouth.
Yes.
Or dropping kibble out of their bowl, pawing repeatedly at their face or muzzle, drooling more than usual, or gums that look angry, red, and swollen.
All major red flags.
It reminds me of the last time I had a tiny pebble stuck in my shoe.
Oh, the worst.
Just one little pebble completely ruins your mood. It changes your gait. It makes you snap at people. It drains your physical energy. Yep. For a small dog, a bad tooth is that pebble. It's quietly dictating how their entire day feels, from the moment they wake up to the moment they try to sleep.
And what's fascinating here is how dental pain acts as a complete physiological domino effect within the body. It goes way beyond a bad mood.
What do you mean?
Well, let's look at sleep. Chronic, low-grade throbbing in the mouth completely disrupts a dog's sleep architecture.
Oh, wow.
Yeah, every time they drift into deep REM sleep, the pain causes a microarousal. They don't fully wake up, but they get pulled out of that restorative sleep phase.
So they're just exhausted.
Exactly. Day after day, they are chronically exhausted, which makes them anxious and way less tolerant of being handled.
That makes so much sense.
And furthermore, that periodontal bacteria we mentioned, it doesn't just stay in the mouth.
Oh, no. Where does it go?
Every time the dog chews, that bacteria is pushed into the bloodstream. It travels through the body and actually showers the heart valves and the kidneys, causing cumulative organ damage over time.
That is wild. The bad breath is literally damaging their heart.
Yes.
So when an owner sees those signs, the dropped food, the face pawing, the shorter temper dismissing it as age-related grumpiness, leaves the dog trapped in that painful domino effect.
Which is just heartbreaking.
It is. Fixing their teeth is step one. But once you resolve that dental pain and they finally want to eat again, we run into a whole new set of challenges regarding what they're actually consuming.
Because their metabolism is shifting.
Right. Their metabolism and their body frame are changing.
It's all about fuel and frame. As their overall activity naturally decreases, their metabolism slows down, which very frequently leads to weight gain.
The classic middle-age spread.
Right. However, the sources emphasize that weight loss or muscle loss is equally, if not more, concerning.
Really? Muscle loss.
Yes, sudden weight loss is often tied back to that dental pain or chronic nausea from deteriorating kidney function, or even a fading sense of smell that makes their regular kibble seem completely unappetizing.
And we should clarify here that there is no magical senior food bag at the pet store that works for every older Havanese.
Oh, absolutely not.
Yeah, it is entirely dependent on the individual dog's blood work. You know, their kidneys, their heart health, their specific digestive needs.
It's highly individualized.
Even the supplement aisle is a minefield. You see hundreds of joint supplements marketed for seniors, but the sources are adamant that these require a vet's targeted approval, not just a flashy label.
Because the clinical efficacy of those supplements varies wildly. What actually matters is introducing elements that biologically intervene in the aging process.
Like what?
For instance, specific EPA and DHA omega-3 fatty acids can actively reduce cellular inflammation in deteriorating joints. But you need the right dosage, which is why your vet has to be involved.
Right, you can't just guess the dose.
Exactly. And this ties directly into assessing their physical frame. Extra weight puts immense grinding strain on aging cartilage. But on the flip side, if they are losing muscle mass, getting up the stairs or just maintaining their balance on a slippery floor suddenly requires a monumental, exhausting effort.
You know, hearing you describe how easily muscle loss can happen, it's making me realize something about this specific breed.
What's that?
Their coat is basically a total camouflage.
Oh, it really is.
It's like they're walking around in a puffy winter parka year-round. If I'm wearing a thick parka in July, you have absolutely no idea if I've gained 10 pounds of fat or lost 10 pounds of muscle underneath it.
That is the perfect way to visualize it. You cannot rely on your eyes with a Havanese.
Because it's all fluff.
Right. Hands-on checks are absolutely vital. You have to get your fingers down through that thick double coat all the way to the skin to regularly feel the ribs and assess the muscle tone along the spine and the hind legs.
So you really have to feel for it.
Yes. If you aren't feeling for muscle wasting, you won't know what's happening until they start showing major mobility red flags.
And those red flags being, limping, hesitating at the bottom of the stairs, or slipping on smooth hardwood floors. And the sources offer a critical warning here about managing that physical pain. Total inactivity actually accelerates muscle wasting, making the weakness worse.
It's a vicious cycle.
Yeah, and under no circumstances should an owner ever give a dog human pain medications like ibuprofen or acetaminophen.
Never.
Their livers and kidneys cannot process them the way ours do, and it can cause fatal organ failure almost immediately.
It's so dangerous. So we have to fundamentally reframe the goal of daily exercise. It is no longer about hitting a magic number on the scale or walking 2 miles to tire them out.
So what's the new goal?
The goal is maintaining joint mobility and mental enrichment without causing inflammation. So you balance rest with modified movement.
Okay, so better beds.
Yes, you invest in a high-quality orthopedic bed, specifically memory foam that supports pressure points, rather than cheap egg crate foam that a dog just sinks through to the hard floor.
That makes a huge difference.
And you swap the forced marches for shorter, more frequent sniffing walks. Letting them slowly meander and sniff a new patch of grass for 15 minutes provides massive sensory stimulation and tires out their brain without putting sheer force on their deteriorating cartilage.
Sniffing walks, I love that. And shifting from physical hurdles to mental enrichment brings up a really important question.
Yeah.
If their physical frame is slowing down, how does that affect their mental map of the house?
Yeah.
We have to look at how the dog actually perceives a world that is suddenly getting Much dimmer and much quieter.
The sensory shifts are where owner observation becomes absolutely critical, because vision and hearing loss almost always masquerade as behavioral issues at first.
Really? How so?
Well, a dog's lenses naturally harden and get cloudy with age. It's a condition called lenticular sclerosis,
Okay.
and this drastically reduces their ability to see in low light. Their auditory nerve also degrades, so you might see a dog startling easily when you walk up behind them, or hesitating at the threshold of a dimly lit hallway.
Because they just can't see what's in there.
Right. They might start barking frantically at sounds that seem to come from nowhere, or show a sudden, stubborn reluctance to explore spaces they used to love.
And beyond just sensory dimming, we have to talk about actual cognitive decline. Canine cognitive dysfunction,
Yes, which is so tough.
which is essentially the dog equivalent of Alzheimer's disease. Plaque builds up in the brain, altering how neurotransmitters function.
Exactly.
The signs are heartbreaking, waking up in the middle of the night and pacing the halls, staring blankly at a wall, getting stuck behind a chair or in a corner, and literally forgetting how to put themselves in reverse to back out of it.
It is heartbreaking, but the real danger, the ultimate masquerade of senior dog care, is that physical pain or systemic illness can perfectly mimic that cognitive decline.
Wait, really? Mimic it?
Oh, absolutely. A urinary tract infection causes massive systemic inflammation that can cross the blood-brain barrier, leading to confusion and pacing. So a dog pacing at 3 a.m. might have canine dementia, or they might just have a terrible UTI. A dog staring at the wall might be cognitively slipping, or they might just have a throbbing toothache that won't let them relax.
Wait, if the symptoms for a UTI, a toothache, and actual brain dementia all look exactly the same, pacing, anxiety, barking at nothing, how is an owner supposed to play detective and figure out what is actually happening?
This raises an important question, and the hard truth is, you don't play detective alone.
Okay, that's a relief.
Yeah, it is impossible to diagnose just by looking at them. What you must do is collect accurate data so your vet can make the diagnosis. You need to track the exact timing and frequency of these behaviors.
So tracking is key.
Essential. The sources mention using data tracking tools, like an app called VitalPet, to log every single time they pace at night, every time they have an accident, every time they refuse a meal.
Just write it all down.
Yes. Because when you bring a month of concrete data to your vet, rather than just saying, he seems off, you give the vet the puzzle pieces they need to differentiate between a UTI and cognitive dysfunction.
Okay, so while the vet handles the medical diagnosis based on our data, what do we do in the meantime?
Right.
Because whether it's sensory loss or cognitive decline, the end result is a dog whose world feels terrifyingly unpredictable.
You focus heavily on restoring their emotional security. If their world is fading, they are going to become clingier, more vocal, or perhaps more withdrawn.
That makes sense. They're scared.
That is genuine insecurity, not bad behavior. To counter this, you keep the physical environment incredibly predictable. You do not suddenly rearrange the living room furniture.
Keep the map the same.
Exactly. If their hearing is going, you start using vibration-based cues, like a heavy footstep on the floorboards, to let them know you're entering the room so they don't startle.
Oh, that's a great tip.
You plug in night lights near their water bowl in their bed to help their failing eyes. You maintain a calm, structured routine to rebuild that lost sense of safety.
Restoring that security ties directly into how we manage their daily physical dignity. Knowing that their body is more sensitive means we have a very real obligation to adapt our routines.
We absolutely do.
Let's talk about grooming, because the Havanese requires constant co-care, and that dynamic completely changes in their senior years.
Grooming must prioritize comfort over appearance, period. As a dog ages, their collagen production plummets. Their skin physically thins out and loses its elasticity. It becomes almost like tissue paper.
Oh, wow. Like tissue paper.
Yeah. Because of this structural change, a mat in their fur isn't just an annoying tangle anymore. It is a tight fist pulling on incredibly delicate, thinning skin, causing acute, constant pain.
So sitting on a grooming table for 2 hours while someone yanks a brush through their coat is absolute torture for a senior dog with joint pain and thin skin.
Precisely. The grooming sessions must be adapted. They need to be shorter, gentler, and more frequent so tangles never have the chance to form.
So changing the style might be necessary.
Exactly. If that means giving your Havanese a much shorter puppy cut so they don't have to endure long brushing sessions on sore hips, then that is the right choice.
Function over fashion.
Yes. And Practically speaking, those short grooming sessions are the absolute best time to do the hands-on checks we talked about earlier, feeling for new lumps or checking for that muscle wasting along the spine.
Then there is house training, which is often the most emotionally taxing part of senior dog care.
It really is.
The sources are definitive on this. Indoor accidents are never a sign of stubbornness in a senior dog. They are a sign of pain, confusion, a side effect of medication, or a mobility issue where they physically couldn't get up fast enough to make it outside.
Yes, and punishing a senior dog for a bladder accident only layers profound psychological stress on top of whatever medical or physical issue caused the accident in the first place.
Wait, I have to push back here.
Okay, go ahead.
Because I think about an exhausted owner who has had a perfectly house-trained dog for 10 years.
Sure.
The owner is standing in the living room, and the dog looks them dead in the eye and pees on an expensive rug. It is incredibly hard not to see that as stubbornness or spite or some kind of behavioral regression.
I completely understand the human frustration. I really do. But you have to look at the mechanics of what is happening to the dog. It is not spite.
Okay, walk me through the mechanics.
As dogs age, the sphincter tone in their bladder weakens. When they feel the urge to go, there is no longer a 10-minute warning window. It is an immediate, uncontrollable emergency.
So they literally can't hold it.
Right. Furthermore, if they have to cross a slippery hardwood floor to get to the back door and they've splayed their legs and micro-torn their groin muscles on that floor before, they are terrified of it.
Oh, man.
They will choose to pee on the living room rug because it provides traction, not because they are trying to ruin your day.
Oh, so what looks like spite is actually self-preservation. That means a potty accident isn't a behavioral failure on the dog's part. It's an infrastructure failure on our part. We haven't built the right non-slip path for them to get to the door safely.
If we connect this to the bigger picture, the ultimate rule of senior home design is that the environment must change before the dog is forced to struggle through it.
Proactive, not reactive.
Yes. You add the carpet runners and non-slip rugs over the hardwood. You set up ramps to the sofa. You lower their sleeping areas. You physically block off steep stairs with gates.
Just make it easy for them.
You do not wait for them to suffer a catastrophic fall down a flight of stairs to realize you needed to adapt the house. You proactively modify the environment to meet their declining physical capabilities today.
So what does this all mean for you? It means tracking absolutely everything. You become a diligent data collector.
It's so important.
You use tools to log their sleep cycles, their bathroom habits, their water intake, and their tolerance for grooming. You map out your home and eliminate the physical hurdles before they become hazards.
Because that's the goal.
Right, because the ultimate goal of the Comprehensive Care Guide isn't to invent a time machine. We are not trying to make an old dog young again. The goal is simply to make today easier.
And that requires us to look at quality of life as a tangible daily metric.
Not just a big picture thing.
Right. Quality of life is not just a grim, hushed conversation you have in the vet's office during the final chapter of their life. It is something you actively measure every single day.
Every single day.
It encompasses their dignity, their physical comfort, their anxiety levels, and a very honest assessment of how the good days compare to the bad ones. Having that open conversation with your veterinarian early on, before there is a major crisis, is not giving up on your dog. It is arguably the most profoundly caring thing you can do for them.
I want to leave you with one final thought to mull over. We spent this entire deep dive talking about how adapting to a dog's senior years requires us to become hyper-observant of unvoiced needs.
Yeah.
We have to notice the slightest hesitation before a jump. We have to alter our floor plans to prevent struggles before they happen. We have to completely redefine what constitutes a good day for a creature that cannot speak to us.
It's a lot of silent listening.
It is. If we practice this level of profound, silent empathy for our dogs, if we can learn to read the invisible struggles of that fading background operating system, does that practice actually rewire our own brains?
That's a fascinating question.
Does paying this much attention to a dog make us more compassionate, more patient, and more attentive to the silent, aging struggles of the humans in our own lives? Something to think about the next time you see your dog hesitate, just for a second, before jumping onto the sofa.